Why do we drink coffee? Because it has several health benefits, packed with antioxidants and vitamins, such as riboflavin, magnesium, and potassium. Coffee can help lessen depression, promote a healthy heart, and reduce the risk of developing type 2 diabetes, Parkinson's disease, Alzheimer's disease, liver disease, and liver cancer. Now you may think, why is coffee that much beneficial? What is inside it? The main constituents of coffee are caffeine, tannin, fixed oil, carbohydrates, and proteins. It contains 2 to 3% caffeine, 3 to 5% tannins, 13% proteins, and 10 to 15% fixed oils. In the seeds, caffeine is present as a salt of chlorogenic acid, CGA. But the central effective part of coffee is caffeine, its effect on the brain. It functions by blocking the effects of adenosine, which is a neurotransmitter that relaxes the brain and makes you feel tired. Usually, adenosine levels build up over the day, making you increasingly more tired and causing you to want to go to sleep. Caffeine helps you stay awake by connecting to adenosine receptors in the brain without activating them. This blocks the effects of adenosine, leading to reduced tiredness. It may also increase blood adrenaline levels and increase brain activity of the neurotransmitters dopamine and norepinephrine. This combination further stimulates the brain and promotes a state of arousal, alertness, and focus. Because it affects your brain, caffeine is often referred to as a psychoactive drug. Additionally, caffeine tends to exert its effects quickly. For instance, the amount found in 1 cup of coffee can take as little as 20 minutes to reach the bloodstream and about 1 hour to get full effectiveness. Is caffeine the only we get in coffee? There are some energy drinks contain caffeine, as well as ingredients such as taurine and guarana. Energy drinks do not hydrate and should not be confused with sports drinks. The caffeine and sugar content of energy drinks is high. In fact, it is often higher than in soft drinks. The levels of caffeine in energy drinks vary between brands, so it is important to read the label before having them. Children and pregnant women should avoid drinking energy drinks. Currently, there are no guidelines for children's intake of caffeine. Caffeine intake should be investigated if children show symptoms of irritability, inability to sleep, interrupted sleep, or stomach upsets. Remember that caffeine is present in many soft drinks and chocolate, not just coffee and tea. The consumption of energy drinks should also be closely monitored. If you are pregnant, limit your caffeine intake to 200 mg per day or less, or avoid it altogether. Having high amounts of caffeine may increase your risk of miscarriage, experiencing a difficult birth, and having a baby with low birth weight. Now you might be confused, is caffeine good or bad for us? One review reports that after participants ingested 37.5 to 450 mg of caffeine, they had improved alertness, short-term recall, and reaction time. In addition, a study linked drinking 2 to 3 cups of caffeinated coffee per day to a 45% lower risk of suicide. Another study reported a 13% lower risk of depression in caffeine consumers. Drinking between 3 to 5 cups of coffee per day or more than 3 cups of tea per day may also reduce the risk of brain diseases such as Alzheimer's and Parkinson's by 28 to 60%. However, coffee also contains a potentially harmful chemical called acrylamide. What is that acrylamide? The chemical acrylamide, or acrylic amide, is a white, odorless crystal compound. It has the chemical formula C3H5NO. It's used to make plastics and treat wastewater, among other things. Overexposure at work can cause damage to your nervous system. It's also thought to increase cancer risk. Every day you're exposed to acrylamide through smoking and secondhand smoke, as well as personal care products and household items. In 2002, Swedish scientists also discovered the compound in a wide range of foods, including baked goods and coffee. Scientists believe the acrylamide in food is a product of the Maillard reaction. This reaction occurs when sugars and amino acids are heated above 248 degrees Fahrenheit. What is known is that when coffee beans are roasted, acrylamide is formed. There's no way to remove it from coffee, so when you drink it, you're exposing yourself to the chemical. Caffeinated coffee is possibly unsafe when taken by mouth for a long time or in high doses. Drinking large amounts of caffeinated coffee might cause headaches, anxiety, agitation, ringing in the ears, and irregular heartbeats. Larger doses might cause headaches, anxiety, agitation, and chest pain. But it's likely safe for most healthy adults when consumed in moderate amounts. Coffee containing caffeine can cause insomnia, nervousness, restlessness, stomach upset, nausea and vomiting, increased heart and breathing rate, and other side effects. So, whatever you do it in a safe way. Stay healthy and stay with health conscious.